Hey, Patrick.
Can you hear me?
Yes, I can hear you now.
Great. So,
I think
yeah.
Mary Jane is going to join again to do the welcome now and at 2. But if
Okay.
you don't see her, then go ahead and start.
Okay. Let
me give you the. I'll make you a co-host.
I am able to share right now.
Okay, I'm going to make you a co-host just in case something happened to my connection.
Well, are you able to manage the meeting room though?
Yes. Yeah. So I'll let I see people in the waiting room already.
Okay.
I just wanted to run the test before, and I'll handle muting and all that stuff. No problem.
Very good. And so let me just share here. See if you can do up.
Hi, Patrick.
Hi, Mary Jane. How are you? Can you hear me, Mary Jane? Okay.
Is Patrick going to start with this up here? Okay, everybody, we're going to start in just a couple of minutes. Or no, not couple. 1 minute. We're just going to let a few more people into this call and we're going to be ready to go. Welcome. Happy Thursday.
Thank you.
Thank you.
You too.
Happy Thursday, all.
You too.
All right, can we get a thumbs up that people can hear okay? Okay, great. All right, welcome everybody. My name is Mary Jane Burke. I'm the Marin County Superintendent of Schools, and this is the second of our Zoom opportunities as we go ahead and move forward so that we can be sure that our district offices and schools will open, be safe for students and staff. So we're really excited. So just a reminder, this will be no longer than a half hour for sure. We will in fact be recording it. Any documents that are referenced will be available to all of you and you'll be able to use in whatever way might work for you. And we're very excited to be providing these opportunities. Obviously pretty important. There's over 154 people already on this call. So today's topic, and note that we're framing this in a, as opposed to return to school, we've decided that it was a better frame to call this rethinking schools, right? Rethinking them, because we know things are going to be different, and we want to make sure that as we think forward that we take full advantage of anything we're learning during these last months, which has been obviously a great deal. Today's focus is specifically on cleaning, disinfecting, and essential protective equipment and how we're going to get it. So at this point, I'm going to turn this over to Patrick, who is going to be the one taking us through this next period. So Patrick, the screen is yours.
Okay, thank you very much, Mary Jane. Good morning, everyone. My name is Patrick McLaughlin, and I am on the Rethinking School Task Force, and I'm going to be taking you through.
Patrick, we can't hear you.
Oh. Can you? I think. Well, I'm going to continue forward. Can someone help with Mary Jane hearing? Okay.
Yep, Patrick, we'll give her a hand.
Okay. All right. So we'll begin the slide presentation here. And so, let's see. Okay. So The goal of the presentation today is to share the strategic plans and protocols that we've been using at the Marin County Office of Education. We're going to be specifically focusing on cleaning and disinfecting and the procurement of EPE. But it's important to note that we have, and we will be continuing to create a number of these trainings. And our goal is that these will serve as a model for other schools and districts moving forward. So I do want to frame some parameters that we're working under when we're creating all of these different strategies and protocols. First is that all of our plans are going to occur in phases, and all of our protocols, products, trainings, procedures are in line with public health, CDC, OSHA, EPA. Another parameter that we're working under is that site-based classroom instruction is a critical component to meeting the academic and social emotional needs for all students, and that COVID-19 is with us for the foreseeable future, and we must begin reopening certain aspects of our society within the confines of this new reality. And that there are proven strategies to do this in a way that lowers the probability of exposure and allows for contact tracing if someone becomes symptomatic. Couple other parameters that we're working under specific to essential protective equipment is that the schools and classrooms will need proper essential protective equipment for students and faculty to return to site-based classroom instruction. And district and county offices of education offices will also need proper EPE for their faculty to return to office-based work. The establishment of a procurement system will better ensure that school campuses and offices have the needed EPE when the students and staff return. And lastly, and I think this is a very important parameter to remember, is that the use of EPE is one of a number of protective measures required to keep staff and students safe. It is very important that this is one measure in conjunction with a lot of measures, i.e. Physical distancing, i.e. making sure people are maybe using bathrooms for single use, i.e. making sure people are using proper hand washing measures, i.e. making sure that people are, if they're symptomatic, they're not coming to work. So EPE is one measure in a variety of measures that need to be implemented to keep our students and staff safe. Really quickly, the implementation process that the Marin County Office of Education has taken. We identified stakeholders, we established a task force, we researched best practices. We have implemented pop-up child care centers for essential workers, and we have used that model to start to pilot special education and alternative education programs. We've created procedures and protocols. We've presented those documents to focus groups and received feedback. And from that feedback, we've created frequently asked questions. We've then shared those documents and frequently asked questions with staff, districts, and agencies. And again, all of this is in phases. Transitioning back to the office has been in phases. Piloting our school programs has been in phases. And as well as continuing to secure the proper EPE. So this whole process has been a step-by-step, very deliberate process as we move forward. And of course, all of these steps have been executed with the guidance of public health and with the understanding that these procedures and protocols are dynamic, they're ever changing. We're gathering information as we go, we're learning best practices. And so all of these procedures and protocols are fluid and changing over time. Quickly about the phases that we've taken, we're phasing in staff coming back to our central office. We're phasing in pilot and alternative education programs. That's really our phase one. Phase 2, we're looking towards our extended school year programs this summer, with Phase 3 being back to school in the upcoming school year. So now focusing specifically on cleaning schedules and EPE kits for classrooms and offices. So our approach here is that we have created cleaning schedules, and these have been based on CDC documents and other industry standards on how and what needs to be sanitized and cleaned, what needs to be disinfected. And so we have created cleaning schedules for our school programs. We have 2 specific cleaning schedules, one for our early education or early elementary classes, and then one's for our middle and high school classes. And we've included our special education in the lower grades, based on the idea that there's a higher level of disinfecting that typically needs to occur in those classrooms. So we have created schedules for cleaning, and those schedules have driven a classroom kit weekly need. And so from these schedules, we've created classroom kits of what we think, what EPE we think each classroom is going to need on a weekly basis. And so we have created that kit. We have done the same thing for our offices. So we have created an office cleaning schedule. And from that office cleaning schedule, we have created an office EPE kit. From there, we have created what we're referring to as an EPE procurement calculator. And the way that works, I'm going to do my best here to share that with you. So the EPE calculator that we've created is an Excel file, and we have instructions on the first tab here. But if you scroll down to the tabs, there are all of the EPE items that we have on our kit lists. We have put into the spreadsheet here, and then we have these cells that you can fill out based on the number of staff you have. For example, if you had 90 staff in your office and you had 5 meeting rooms and 6 bathrooms and 4 entrances over a certain amount of time. So the way that we've created our calculator for the offices is based on number of staff, number of meeting rooms, number of bathrooms, because all those places are going to have the kits over a period of time. And then you will, if you had any classes, for example, if you were doing this for a school, you would add the number of classes that you have and the number of weeks that you would need the materials. So you can add the information based on what your specific needs will be, depending on your school and office space. And then at the end of the tab, there will be a total amount of EPE materials that you will need for that given period of time. And if you have a specific cost for those items, depending on the custodial vendor that you use, you could put that in there and it'll actually give you a total cost for all of the EPE for a certain period of time. So that is the calculator that we've created, and that will be shared on our website for your review. And it is noted that in our document that we will also be sharing is a real thorough description of how to use that EPE procurement calculator. One other thing that we've created is we've created an EPE burn rate calculator. And I'm not going to show you that in this presentation, but it is a similar type of calculator that I just showed you. But what this one does is it helps you determine how much EPE that you are using over a period of time. So basically what you're doing is you will be inventorying your supply at the beginning, at the end of the week. You put in those numbers, and then over about a month, you will come up with an EPE product use per person per week. And the importance of this is that the kits that we have created are based on our pop-up childcare and over the last few weeks within our office. And so the actual amount of EPE is going to change depending on programs and the number of staff. And so this is a really good tool to actually determine the amount of product that's being used per person per week within your specific organization. We also have started to focus on the proper use of cleaning and disinfecting. And this is within the document that we'll be providing on our website as well. Some of the parameters that we are following, obviously all staff must follow the labeled directions. There needs to be proper training for all staff before the use of any cleaner, sanitizer, or disinfectant. We also recommend that school administrators work with their maintenance directors, custodial suppliers, and insurance providers to create and implement these trainings, and we will be providing some trainings as well on our website. One thing that's also really important about the use of cleaners and disinfectants during the time of COVID-19 is that all of those need to be first kept out of the reach of the students, but they need to be approved against COVID-19 on the Environmental Protection Agency approved list. And there is a link there for that. You just need to put in the product EPA number, and it'll tell you if it's an appropriate disinfectant to use for COVID-19. We're also strongly recommending that you provide trainings to your staff. And the specific trainings that we're recommending is helping your office staff and teaching staff know the difference between cleaning, sanitizing, and disinfecting, how to properly use personal protective equipment when using disinfecting, how to clean properly, how to sanitize, how to disinfect, and how to use sanitizing and disinfecting wipes and what the difference is. We will be providing examples of these trainings forthcoming, and those will be on our website as well. Also, it's important to note that in our calculators and on our kit lists, we have identified specific disinfectants and sanitizers, and we encourage all schools and offices to use what disinfecting and sanitizer that they typically use. It's just very important that it meets that Environmental Protection Agency approved list. Lastly, in regards to procurement of these materials, our plan at MCOE is to order quarterly. The order amounts, we are going to be ordering for a 3-month period using the calculator. Our first order is targeted in early June, with subsequent orders happening throughout the year. Procurement is a potential big challenge right now, and so what we're recommending is that school and office administrators work with their individual custodial suppliers after they've come up with their estimated EPE needs. There is also a resource on the Marin Recovers, and there's a link here on the PowerPoint as well as in our protocols and procedures to access that link. And on that link, there are a number of other providers that can supply EPE. Lastly, on our website, the Marin County Office of Education website, we will be posting all of this information. You just go to the for MCOE, COE, or for the Marin COE staff tab, go down to COVID-19 office and school protocols, and we have provided all of the different trainings and presentations that we're going to that we've done and we will be doing over the next few weeks. This is an example of the central office training that we did on Tuesday. There will be a similar link by the end of the week that is specific to the procurement of EPE. One last thing that we have been doing and we think is very, very important is that we have continued to do regular check-ins with our team, and we have provided a phone number as well as a email for any questions, comments, or concerns. And we have found that by listening to team members and other agencies and districts and partners, that it just keeps getting better. Our protocols keep getting better. Our systems keep getting better. So we strongly, encourage you to send any questions, comments, thoughts to us through this rapid response at marinschools.org, and to perhaps create your own email that you can gather frequently asked questions from your team as you move forward through this process. And with that, I will open it up to questions.
Great. So there's a few questions in the chat room. One of them is there a plan for concerted effort to procure our EPE supplies across Marin districts? So just for you to know, we just had a meeting yesterday, I guess afternoon, with OES, Office of Emergency Services. And here's the plan, is that we are each going to go ahead and use the calculator if you want and get your ordering set up. In the event that we have difficulty or there is anything that we can't get a hold of, then we will be working directly with the Office of Emergency Services to support us. So that is the plan in terms of how we'll be doing it. And we think that will be the best and most efficient, rather than take everything to a central location and then redeploy it out to our schools and districts. So that's the answer to that. Several questions about making sure all this information is shared, and I think you have that now, that everything that we're doing is available to you to use as appropriate. Please feel free to take our name off of it, put your name on it if you'd like, and we'll be ready to share every single thing. Well, MCOEs, so the question about will we, so let's go back. The question had to do with, what about if I'm a private, independent, or parochial school? So that would apply. So if we would want every school entity or office to use the calculator, make their orders, in the event that they're having difficulty, to let us know, and at that point we will be working with OES. So no, we do not provide supplies. Let me just see if there's any other questions. Are portable disinfectant foggers recommended? Who can answer that for me, Patrick? Or Patrick, can you answer
I
that?
can do my best with that. I know that was a conversation that came up at the maintenance directors meeting that we had recently. And so I think that's going to be really a decision that's made individually at the district. But there is a lot of promising, there's a lot of promise in that way of disinfecting. But I think that it would have to be a cost-based analysis and really a decision at the district or office level.
Mm-hmm. A question about what's the difference between sanitizing and disinfecting?
So we are going to be providing some training on that, but ultimately the difference between disinfecting and sanitizing is disinfecting kills a higher percentage of viruses, bacteria, and fungi, and so it's a stronger chemical, or a more concentrated chemical that has a higher kill rate.
Mm-hmm. A question came up about what is the software being used to power the QR code survey check-in sheet. So just for you to know, we essentially took what was set up at the Office of Emergency Services and copied it. Mike Grant, can you answer that question? What's the software there?
Mary Jane, I have a link to the software I can put in the chat room right now.
Okay, great. Thanks, Ken. Appreciate it. What do you recommend to accommodate staff with high-risk conditions? So on that point, just for you to know, as we're working countywide right now, we have several different groups that are working. One of them obviously is this group working on reopening, what the PPE is going to look like, or EPE, along with training around disinfecting, etc. So that's a group. There's another group that is going to be working at the personnel level around personnel issues that might come up. So a question here about what about a staff member who might have some sort of underlying health condition. And so do know that the bottom line will be that we will be using systems that have been in effect for many, many years around how do we figure out what an individual staff member needs. So the structure will be, if a staff member has something special that needs to be looked at, they would get a letter from their doctor describing what it is, and then ultimately the school district would determine whether or not they can accommodate that. So, but in the bigger story, the personnel teams right now there's a team that's working on that, chaired by Lars Christensen and Raquel Rose, and they will be bringing together others that will be looking at various personnel issues. So, you know, the structure here, just like this, a team of people begins work, develops a protocol, some thinking, then we will open it up to the larger group like we are here, get additional input, make modifications. So we'll be doing that in the, you know, in this area, in the personnel area, we'll be doing it in the communication area. So we're already working on what is the communication that will need to be available